Again, that main stem cell gives rise to all the different cells. They have their own lineage. So this is the key thing I want you to know or understand. The lymphoid cells, B, T, and natural killer, they normally travel in blood and lymphatic tissues, which means that they can give rise to a leukemia or a lymphoma. It just depends on the location where it hits. Okay, so they can give rise to a leukemia or a lymphoma. It just depends on the location that it targets. When we talk about myeloid cells, they only travel through the blood. So they can only develop a leukemia, never a lymphoma. Okay, so it's just a matter of location. Okay. So, moving on. Slide down. Cross out 6 and 7. That's just introduction. We don't need to get into that. We're going to go over each and every leukemia. That's just listening along. Okay, so this particular slide goes over possible risk factors. Okay, now we know that there's no known cure for cancer, or no known, I should say, cause for cancer, which that would be the cure if we knew it was. However, there's tons of different risk factors. Okay, and we talked about some last week as far as nutrition and smoking and different lifestyle things. However, they do believe that there are certain risk factors that can possibly lead patients into a leukemia or lymphoma. They do believe that viruses, radiation exposure, and chemical exposure is kind of on the top of the list. Okay, so let's go over those things. So they do believe that there are some viruses, and I'm going to give you the viruses if you want to jot down. They do believe that retroviruses, herpes viruses, and the Epstein-Barr virus, they do believe that these viruses could be a risk factor, okay, for leukemias and lymphomas. And to be exact, they do say that Epstein-Barr virus is one of the major risk factors for Hodgkin's lymphoma. It is one of the major risk factors for Hodgkin's lymphoma. Now, when we talk about radiation exposure and chemical exposure, just to give you an example, we know that radiation, even chemotherapy that is used for patients that are already undergoing cancer treatment is sometimes a little harsh on the body, correct? Why? Because these types of agents attack cells that are rapidly dividing. And what are the most rapidly dividing cells in the body? Epithelium and blood. Epithelial and blood cells are the most rapidly dividing cells in the body, which means that they are more vulnerable to these types of things. So blood cells are very vulnerable to radiation and chemical exposure. Another good example, you guys know when people go in for a plain film x-ray, what is it that they give them? Or put over them? Some sort of lead shield, okay? Why? You want to protect that epithelium, okay? You want to protect those cells. And most of the times they're usually concerned about the thyroid and the gonads, okay? Why? Because those cells have a high turnover rate, so they're very vulnerable to those types of things, okay? So just keep that in mind. The radiation exposure and chemical exposure is due to the fact that those cells are sensitive, okay, because they have a high turnover rate. Okay, so, signs and symptoms. Now, I will tell you this. Signs and symptoms are pretty much very common, or I shouldn't say common, but very much the same across the board for all leukemias. Okay, so when I go through each and every leukemia, I will tell you guys what's a particular hallmark or something that stands out to help you. Sometimes students have a difficult time with the second test because the signs and symptoms are all the same. However, make sure you utilize your pictures, okay, because each picture is different. Utilize those hallmarks, those things that stand out, okay, to help you get to your answer. You don't want to kind of harp on, okay, well, weight loss and fatigue, we know that kind of happens with any cancer. So just look at, those major things. Okay, so we all know that what happens with cancer, and not just any cancer, but even definitely leukemias, these patients will definitely undergo bone marrow suppression. So all of the blood cells will be decreased. Okay, so they can have a leukopenia, which we know is a decrease in white blood cells, and so they will have signs and symptoms and conditions that will develop because of that. So lymphadenopathy, joint swelling, pain, weight loss, anorexia, hepatomegaly, splenomegaly. Anemia, we know a decrease in red blood cell count, and that's because, that's because of the bone marrow suppression. But their signs and symptoms are because of the lack of red blood cell count and the lack of oxygen carrying capacity in the blood, which is why they're tired, which is why they have shortness of breath and things like that. Thrombocytopenia, decrease in platelet count. And so this is going to lead to possible bleeding, issues. So we're going to go over, and I'll give you some examples of what they have here. So the first type of bleeding they have here, let me just say this. Don't worry about this lab value here, okay? I'm going to tell you the ones in your image sheet. We'll focus on those. So, petechia, I always pronounce that correctly, petechia. This is going to be bleeding on the skin, and if you guys look in your image sheet, I want to say the third page, there's a picture of a child, I think, that has its arm, okay? And you see little red pinpoint dots. It almost looks like a rash, okay, or freckles or something. That's actually bleeding under the skin, okay? And so one thing that you can do if there is, you suspect bleeding, is actually looking at the person's skin, because sometimes you can see those types of bleeding conditions that can come through the epithelium. Now, obviously, those that are internal you can't see, but that is one way you can assess, okay? Also, bruising. Bruising is another way you can assess, okay? So we do have a picture of bruising at the bottom, also on that page. That particular type is called ecchymosis, I believe, and so that's what we call a flat bruise. And then a raised bruise is more like a hematoma. But keep in mind that bruising is just that bleeding that could also happen under the skin. But we know, looking at those pictures, believe it or not, especially bruising, that can be from a number of things. So it can be that someone has cancer, someone has a blood disorder, maybe it was a trauma. So it could be a variety of things. Okay, so that's that. Bleeding gums, occult hematuria. So let me break this down. And I probably should have put this on medical terms. Heme for blood, urea for urine. So blood and urine. Now they have here a description of the type of blood, which is called occult. So let me go over that. So there can be ways you could describe blood, believe it or not. And it kind of gives you a clue as to what could be going on. So when you see the term occult, and there's another term that's the opposite of it called frank blood. So occult blood, the best way I can explain it is saying hidden blood. Okay, hidden blood. This blood is going to be dark red in nature, usually from a chronic, a long-standing sort of disease process. Okay, occult, meaning like hidden. Frank, fresh. So this is more like fresh blood, bright red in nature, usually more commonly associated with acute type disorders, maybe some sort of trauma or whatever. So just to give you an example, say for example we have a person that has colon cancer, okay, and they're having bleeding from the rectum. That type of blood, initially it might be a little frank, but because of the long-standing disease process that's occurring, that blood is going to be considered more of an occult blood, okay, because it's going to be dark in red nature, things like that. Now, on the flip side, let's say if we had someone that had hemorrhoids, okay, and so maybe they had epithelial tear and they have bleeding in that area, that type of bleeding is going to be more of a fresh blood, okay, bright red in nature, more frank. So that's the difference. Okay, So, okay, retinal hemorrhage. Now, neutropenia. They have neutropenia in a class by itself. Okay, why? We already discussed earlier that neutrophils are the most abundant white blood cells circulating in the bloodstream. They're our first line of defense, so they're the first ones there for whatever's going on, which means that if a patient suffers from neutropenia, please understand that this is pretty much the start of them being in an immune compromised state, okay, because that first line of defense is weak. They do not have enough neutrophils. So this is why they make a big to-do about it, okay, looking at the neutrophil count. Another thing, evaluation of a peripheral blood smear, okay, which is what we pretty much just did when we looked at our blood slides. Those slides are what is called a peripheral blood smear. I remember years ago, I don't think they do this anymore with anatomy and physiology labs, but years ago, one of the labs was to take your own finger and prick it, and then you kind of prep your own slides, okay? So you would prep your own peripheral smear, take another slide at a 45-degree angle, swipe it across, smear it, let it dry, and then you're able to look at the cells. This is so important because looking at the cells, what we just did earlier, describing the size, the shape of the nucleus, is it granulated, what's in the cytoplasm, what color is it? This is so important because this tells us if we have a normal cell or if we have a cell that is malignant. And to be honest, sometimes patients that have chronic leukemias, they don't know until they go in for a routine blood work because their signs and symptoms don't really show up immediately. And so that's a sad thing. I actually know someone that happened to. So their signs and symptoms are a little vague, but what happens when they go in for the physical, have blood work done, peripheral smears looked at, then they're able to discover that this person has a malignancy in the white blood cell. Now, once they discover that, they can, obviously a more definitive diagnosis is a biopsy. So if it is a leukemia, they can do a biopsy in the bone marrow. For a lymphoma, they'll do a biopsy in the lymph node, okay, whichever location. Treatment. Most of the times, the primary treatment, they say, is a combination of chemo to remove malignant cells and stem cell transplant to restore the bone. Now, chemotherapy, I would say, is probably the most commonly used therapy for leukemias. Why? Chemotherapy, we know, attacks the rapidly dividing cells of the malignant cells. However, when you think about it, chemotherapy attacks the whole body, pretty much, which is what you kind of want to do in this situation because what's going on is through the entire bloodstream, okay? So this is why chemotherapy is kind of the treatment of choice. Stem cell transplant can be used also to kind of introduce or give that person new healthy bone marrow tissue to kind of help them fight the disease as well. Let me tell you this, and this is protocol. Patients that have a stem cell transplant, they have to have chemotherapy done first. Okay, you just can't go in and have a stem cell transplant. They have to have chemotherapy done first to make sure they kill all the malignant cells and then give them nice healthy bone marrow tissue. Okay, and that makes sense. So they have to have a chemotherapy treatment first. Now, radiation and tissue-specific drug therapies, those are used only in cases that are more for localized type situations. So say if someone had like a lymphoma that was one little single lymph node, okay, they may not need a full, chemotherapy treatment, but they can just do radiation or more specific type treatment for that. Now, this slide goes over that whole remission discussion that we talked about last week, okay? So, the goal of chemotherapy is to get this patient into remission, okay? So chemotherapy, we know, is aggressive, attack, get all those malignant cells out as fast as you can to get this patient into a remission. The goal here, obviously, is to keep that patient into remission as long as possible, okay? So what is called complete remission as far as leukemia is concerned? Complete remission is making sure that person has no more leukemic cells. Okay, so when they have their bloodstream tested, when they have their blood tested, no more leukemic cells, and making sure all the blood cells are back to normal. So no more bone marrow suppression. So everything is good. Now, they will continue some cycles, okay, even after, which I'll show you in a second. So CR stands for complete remission. It's not a cure, as we talked about last week. We can't say, oh, this person is cured from cancer. The proper term is they're in a complete remission, okay, and we want to try to keep them there as long as possible. So they give you a whole bunch of other terms here: remission induction, post-remission, remission maintenance, okay. So what does that mean? All of this means is that once this person is in a complete remission and we say, okay, they're good to go, if you want to maintain that person into a complete remission, do you still continue treatment, or you just leave them the way they are? What do you think you would want to do?
Treatment.
Still continue treatment. Believe it or not, these patients still continue some chemotherapy treatment, I'm gonna jump to this slide, even 2 to 3 years after remission, okay? And I'm gonna show you the reason why. So, we all know that cells go through a maturation process. If the person down here looks great, okay, all the mature cells, everything looks good, they're in a remission, is it a possibility even in a remission state that they can now have another leukemic cell coming down the line? Yes, because we know the turnover rate. And so this is why they want to continue this chemotherapy treatment even after, okay? And even some leukemias, if I can remember, I think it's ALL, they even get as aggressive as, even when they're in complete remission, sometimes to do chemotherapy and a stem cell transplant, even after, just to make sure, okay, because again, it's aggressive, and so you don't know what cell is going to develop next, okay. All right, so some more complications that could occur. We know that the wasting syndrome we talked about last week can happen across the board with any type of leukemia or any type of cancer, so the anorexia, weight loss, things like that. Stomatitis, this is a term, I think this is a new term for us, that is an inflammation of the oral mucosa, so an inflammation of the mouth, inflammation of the oral mucosa. And so sometimes it can attack the mouth and mucous membrane. Growth delay, and a very, very important thing here, infection. Okay. Now, just want to touch on this a little bit: infection, prevention, and early detection. Okay. So we already said that these patients are going to be bone marrow suppressed, leukopenia, which means that they are more susceptible for infections. And this, I believe, is where you guys come in with your job as nurses. What could you do to prevent a patient from an infection, possible risk for infection?
Will you be giving them shots to bring up their?
Yes, you can definitely do some sort of immunotherapy type treatments to help them. What else? What else can you do to kind of prevent a possible infection? And this is important. I'm going to tell you why in a second. Yes?
Basic hand washing and always having your gloves and a mask.
Very good. Yes. So all of the hygiene and the proper precautions that you should be taking in that setting, okay, as far as hand washing, making sure you're wearing your gloves and things like that, making sure you're protected, they're protected, okay, from picking up any environmental type germs, okay. Also, isolation can be done, okay, if it's a person that bad of immunocompromised state. So keep in mind, the big picture is this. Even sometimes you guys know that patients or people are given antibiotics sometimes, even if they don't have a known bacterial infection. Why? Because this person is at a very high risk for developing infection, and especially the environment. Why is that so important? If you prevent an infection in this patient, this is so important because they already have low white blood cell count. If they get an infection, Is it gonna be very hard for them to battle that infection? Yes. So you're gonna be working double time if they ever get an infection. And not only that, if that infection isn't caught early enough or in a timely fashion, what could that lead to? Sepsis, okay, and lead to possible death if it gets to that point. Because keep in mind that they can't fight it that easily. Yes.
So are they, well, depending on how drastic the cancer is can it be as compromised as AIDS, like that bad?
It could if it gets well, not as deteriorating like that, but it can be. So they're not able to fight infections that easily, which means that they can have complications of an infection or complications of a bleeding disorder and things like that if it's not taken care of. But the whole point here is that you want to try to do early detection and prevention of it so it doesn't get to that point. Okay, and so when you guys get into your nursing management, they'll go over more so of all exactly what you would do with that. But again, the big premise here is to make sure you know that they don't have enough cells to fight it. Now, will their cells keep declining like a person with HIV and AIDS? It's a possibility, because especially we know with chemotherapy and how that conducively attacks everything, it's a possibility. It just depends on what stage they're at. Okay. Bone marrow transplantation. This is used to manage certain types of leukemia. And so just a few things I want to highlight here. We already said that with any type of bone marrow implantation, patients have to have chemotherapy done first. Okay, so first chemotherapy, and that's that. Stem cells are reintroduced into the bone marrow. Okay, so they put it in, nice healthy bone marrow tissue, okay, hopefully to boost up, okay, the process of these cells and boost up obviously their immune system and everything else. I don't know if I told you guys this story, but I was reading a story on Yahoo News one time, and this was years ago, and the patient had leukemia, I don't know which type it was, but had leukemia and HIV at the same time. Okay, they did a bone marrow transplant, and so it's for the leukemia as a treatment for the leukemia. And what wound up happening was it actually had the HIV, the virus, undetected. So what happened was the bone marrow tissue boosted up this person's immune system to the point that it attacked the virus. Now, how long did they stay in that state? I don't know. Okay, I don't know if it went into a remission or whatever for that. But it made sense to me. Now, everyone can't get a bone marrow transplant, treatment for that. But it made sense because if you give a person, it's almost like giving a person a new immune system. And so now they have enough cells to fight it. So I thought that was an interesting case. Now, they say close match necessary. Okay, yes, that is necessary, obviously, for any kind of implantation. Or if it's not a close match, you can have what is called graft versus host disease. So this is pretty much that cytotoxic, cytolytic process that we discussed earlier, where the body will definitely attack, okay, if it's a foreign tissue that the body rejects. And peripheral stem cell transplantation allows cells to be harvested from circulating blood. And I'm going to show you what that means. It's a process called autologous transplantation. So autologous transplantation is when the stem cells from the patient's own blood is reinfused back into their body. Okay. This procedure is kind of like dialysis. The process is called apheresis. So they take the blood out of the patient. It goes into this machine and it actually pulls out, okay, the nice healthy cells and reintroduce it back into the patient. Okay. Now, this particular type of transplant is not used on every person. Obviously, they have to be healthy enough, you know, as far as a certain blood levels to even have that done. But that is one way they can do it. Allogenic transplantation, this is where most commonly used when you have a donor, okay? And then that way they can introduce the stem cells. And graft versus leukemia, I don't know how often this is used, but they do use some sort of allograft. This is different than bone marrow transplant, but it's more like an immunotype graft that they put in the bone marrow to kind of help attack the leukemic cells. Okay, I'm not sure exactly what in that graft, but I would assume it's probably some sort of immune cells, type of immunotherapy to attack the cancer. Okay. So that's just a picture of what we just discussed. And other complications, anemia, again, we all know what an anemia is by now, but I just want to focus on what you would do to treat the anemia. Administer erythropoietin growth factors, and I believe this is an injection. Okay. Erythropoietin growth factors, I know you guys remember from anatomy, erythropoietin comes from the kidney and it helps make red blood cells, so you can give them that to help make red blood cells. Red blood cell transfusion if the count is that low. Okay. And control the bleeding. Okay, again, this is more nursing management. Control the bleeding, making sure that that is taken care of so they don't keep losing blood, okay, to be in that state of an anemia. Pain. Pain we know can be from any disease or anything, okay? However, patients that have leukemia classically have bone pain. Why? Because it's attacking the bone marrow. Okay, so bone pain is actually one of the most common types of pain that they have, most commonly in the bones and the joints. Another thing I want to point out is heme arthrosis. Sometimes they can have bleeding in the joints. And I do have a picture of heme arthrosis. I think it's on the 4th page. If you turn, and there's a child with the elbow. Okay. So that's an example of heme arthrosis. And this is bleeding in the joints. With that, again, these bleeding types of conditions can be from a number of things, okay? So that bleeding in the joints can be from a leukemia, that could be from a fracture, maybe that could be from an osteosarcoma, or that can be maybe that child suffers from hemophilia, okay? Because patients that suffer from hemophilia, a classic thing that they have is bleeding in the joints too, okay? So just to let you know. So it could be a number of things with that. But they do have heme arthrosis. Painful procedures, and we know with the stomatitis, we can do that already. And very last thing, we already discussed this. We know that epithelial cells are more vulnerable to radiation. We already discussed. Okay. All right. Let's take a break here. I think this is a good point to take a break before we move on to the second half. Can you stop? Yes. Thank you.